إن شاء الله.
إن شاء الله. السلام عليكم. Good morning.
السلام دكتور.
Today
حمزة رنيت علي هسه.
أهلا وسهلا. أنا دخلت بالحقيقة، كانت الدكتورة بتشرح لكم لسه، فحبيت بس أعطيك ملاحظة.
خلاص وصلت.
شكرا.
يعطيك العافية دكتور.
الله يعافيك عيني. Today we'll speak about a new group of viruses which are called arboviruses. And arboviruses can cause arbovirus diseases. So we are going to talk the relationship between these viruses and the diseases they cause. It's a special lecture. If you understand it properly and write a few notes, it will be easy to you. If we look to the learning objectives about arboviruses and the diseases they cause, we are going to talk about classifications of these diseases in relation to the viruses, epidemiology, a few lines about clinical presentation, laboratory diagnosis, only a few lines about the treatment, and then prevention. This is the theme of the lecture. So starting from arboviruses, what's the meaning of arbo? Arboviruses, the word arbo, it comes from Arthropod-born zoonotic viruses. And we will talk in more details about them. They are transmitted by insects. These insects are blood-sucking insects. تتغذى على الدم. Like what? Like mosquitos, البعوض, ticks, القراب, sandflies, Phlebotomus. You remember when we have talked about leishmaniasis, we talked about sandfly. The families that we have mentioned previously and the genera that cause these viruses belong to those which we have studied them with the CNS1 module. The Togavirus, Flavivirus, Bunyavirus, and Ribaviruses. The Togavirus, mainly of the genus Alpha. You remember these viruses, and we have studied their structure. Today, we are going to go into more details into their diseases. So, arboviruses can cause inflammation of the brain. Inflammation of the brain parenchyma is called encephalitis, or some people pronounce it as encephalitis. Both are correct. There will be damage of the neural cells, may be fatal, and also may lead to permanent neurological damage to the survivors who survive the disease can have sequelae complications later on. Others, such as dengue viruses, can produce illnesses could be very mild, flu-like, or it could be very severe, shock with hemorrhage. Remember, dengue, pronounce it properly. Dengue viruses can cause hemorrhage. Is one of the viruses that can cause hemorrhagic fevers. Other, like yellow fever virus, can damage the liver and can lead to destruction of the liver and hepatic failure. So these are the arboviruses. As I said, the genus and the members of the viruses. If we talk about the Togaviruses, and we said genus Alphavirus is the most important one, we have many diseases, but we are going to select only the first two. Western equine, sorry, Western equine, كلمة equine, it means horses, الحصان. Western equine, it means it is related to the horse and also can infect a human being. So Western equine encephalitis, Eastern equine encephalitis. They are transmitted by mosquitoes, can cause encephalitis. Bunyaviruses, California virus, again, mosquito, encephalitis. So we are going just to take the California virus as example from this group. Flavivirus, St. Louis encephalitis, mosquito encephalitis. Western Nile, these will skip them because belong to other systems. Western Nile fever, also mosquito, can cause febrile illness or encephalitis. And these are the countries where they are predominant. Powassan, another one in Canada, transmitted by tick. Remember, we are always saying mosquito, mosquito. The Powassan, it is transmitted by tick, al-qarrab, and can cause encephalitis. Japanese bee encephalitis can be transmitted by mosquito and cause encephalitis. Colorado tick fever, it is transmitted by tick and can cause febrile illness. The Colorado tick fever, which belongs to the Rio viruses, we will leave it when we talk about the ticks. So this table summarizes to you what we are going to speak about in the rest of the lecture. So remember one thing from this table: the disease, the virus, and the transmitter, the vector. It means the insect or the arthropod that is going to transmit it. We call it vector. Now we come to the epidemiology. Arthropod-borne viruses. Arthropod, it means those insects which has joints. Pods, it means foot. These arthropods characterized by joint limbs, يعني أرجل فيها مفاصل. And chitin cuticle, يعني it covers itself بمادة صلبة اسمها chitin cuticle. مثل درع تحامي نفسها, like mosquito. Arachnids, we will talk about arachnids next lecture, inshallah, like the ticks, al-qarrab. So arthropod, it means that these diseases are transmitted by arthropod. So arthropod-borne viruses. If you take the AR and BO and V, will be Arboviruses. فكلمة Arboviruses هي الحروف الأولى من 3 كلمات: Arthropod-born and virus. AR from arthropod, BO from born, V from virus, you will get Arboviruses. So these diseases are transmitted by these insects or arthropods. Some of these diseases involve a human and mosquitoes, transmitted between a human and mosquitoes. Other involve also non-human vertebrates, like birds. We are not going to concentrate a lot about this. We will take summary. So you should know these diseases, the arboviruses diseases. It could be between insects and a human, could be between insects and vertebrates and a human. So we will see that in the coming slides. Vertical transmission could occur. That is to say, in the vectors, in the insects. The insect can transmit the virus to its generations. Viremia can develop in a human being, which could be long-term viremia, presence of the virus in the blood without a clinical disease in a human or invertebrate. A blind end host, يعني الهوست الذي يأتي إليه الفيروس, and it will be the end of the virus there. Could be human, could be horses, like the equine viruses, which I have mentioned, cattle, etc. The cycles of a transmission, انتوا تعرفوا نحن بدنا نحكي على insects وانتقال أمراض بواسطة الانسكتس إلى الإنسان. So the transmission cycle could be urban, في المدن، حضري. Sylvatic يعني برية، في الخلا. Or some of the diseases are arthropod-sustained. Remember this word. It stays in the arthropod, like tick, from tick to another tick, and so on. It stays sustained. Sometimes it can go to human or to animals. So you have urban cycle, sylvatic cycle, and arthropod-sustained cycle. هاي كلها مقدمة لهذه الأمراض اللي راح ناخذها بعد شوي اللي تنقل بهاي الفيروسات. These diseases and these insects vary from season to season according to their survival mechanism. So, such as sustained viremia in lower vertebrate. Lower vertebrate may have sustained viremia for a long time. The first figure here, general features of arboviruses transmitted cycles, including urban, mosquito, human mosquito, sylvatic, البرية, birds, monkeys, small mammals, and human. Arthropod-sustained, small mammal, tick, sometimes to human. So it is from the ticks, sustained in the tick, sometimes infect small mammals, sometimes infect a human being. So look here, this is the bird, this is the virus to the insect, and then the circle will be completed. The insect cycle, it could be terrestrial يعني البرية, or aquatic يعني بالماء. هذه الانسكت تعيش إما على البر أو في المياه. Adult insect can form eggs, then larvae, pupae, and then adults, and so on. يعني هنالك انتقال من الحشرات إلى الإنسان مباشرة أو تنتقل عن طريق حيوانات أخرى like birds, monkey, etc. أو sustained inside the arthropod and accidentally it goes to human or it goes to small mammals. This is the summary of it. So we will see it. The airborne, you can see man, mosquito, man, mosquito. Example of this, dengue fever, yellow fever, and occasional outbreak of St. Louis encephalitis, which we have mentioned them in the beginning. So remember this point. What are the diseases of the airborne cycle? Dengue, yellow fever, St. Louis. Sylvatic, monkey, mosquito, and so on. A human being may be infected accidentally. Important example of this is the jungle يعني الغابات. jungle yellow fever اللي حكينا عليه قبل شوي كانت urban الحضري. urban yellow fever, urban dengue. Now, in other sylvatic cycle, the viruses multiply in vertebrate reservoir, like bird, go to mosquito, then to these birds, snakes, small mammals, those which overwintering reservoir. Overwintering يعني في الشتاء. From the mosquito, they go to the man, sometimes to the horses. These are blind end for the virus. Examples include Western Equine, Eastern Equine. راح نتكلم عليهم بعد شوي. California, St. Louis encephalitis, yellow fever. These are good examples of such a cycle, which involves other animals multiply in a vertebrate reservoir. Arthropods sustained, as I said, tick, tick, tick. Then they can go to small mammals and go to the human via milk and other ways, and go to cattle, goats, etc. These are blind end hosts. Example, tick-borne encephalitis in Russia, and sometimes called Russian tick-borne encephalitis. هذه كانت كلها زي الاستعداد للكلام عن الأمراض. طريقة دراسة هذه الفيروسز مع هذه الأمراض، أنا أقترح عليكم أن كل واحد يأخذ له ورقة صغيرة يعمل فيها جدول عن الانسكت، عن الهوست، عن البيشنت، especially the age of the patient. شو هو الديزيز، يعني ايش يحصل بالديزيز، المورتاليتي ريت، شو الفيكتور اللي عملت الترانسميشن، شو الكومبليكيشنز اللي تحصل. هيك في التيبل صغير وواحد من يحط المعلومات على بعضها راح تكون سهلة جدا عليكم. وأيضا ممكن كل طالب يقرأها بالطريقة اللي هو يرتئيها مناسبة إلى، بس أنا دا أقترح عليكم هذا الإشي. يعني ممكن إذا أنت عملت تيبل ممكن تقرأها لاي كلها خلال ربع ساعة. هسه Western Equine Encephalitis caused by what? Western Equine Encephalitis virus. This is Alphavirus, belong to Togavirus families. Okay, so it is Alphavirus. الفيكتور mosquito. السبيشيز الجينس وسبيشيز Equus tarsalis. If you say Equulix, it will be enough. Okay, so Equulix mosquito. common in Western USA, for example. So you can expect such a question if anybody in the future is going to go into USMLE examination. You are going to encounter these questions because such diseases are common in US. The blind end host, as I said, a human or horse. This disease is mainly in infants. So if you get a scenario saying to you, infants is suffer from so and so, so you have to keep in mind it could be Western equine encephalitis. So the key point is infant. The range, it could be mild, non-specific febrile illness, حرارة فقط, to aseptic meningitis or severe encephalitis. That is why we study them in PNS. It can cause severe encephalitis or aseptic meningitis. You remember the word aseptic meningitis, we have coined it to viral causes. Mortality, 5% from encephalitis. Complications in the survival, 60% of the survival could have a neurological impairment after cure, after recovery from the disease. So if you read it this way, it will be simple to you. Now we go to Eastern equine. It is caused by Eastern equine encephalitis virus. Again, Alphavirus, Toga. The mosquito vector is Culisetta. فقط Culisetta أريد منكم. Okay? Feed on horses, birds, human. Common in England, South America. Can cause severe encephalitis, all ages. Look, the Western, we said infants. Now we are talking about all ages. Mortality rate higher, 33% up to 50%. The sequelae, the neurological sequelae after this infection is high. So again, if you insert these things in your table, it will be very simple for you. St. Louis encephalitis. It is caused by St. Louis encephalitis virus. يعني اسم الفيروس واسم الديزيز the same. انتوا هتشوفون هذا الإكزامبل الثالث. It is transmitted or this virus is a Flavivirus. So the disease is caused by Flavivirus, which is St. Louis encephalitis virus. حكينا الأولى كانت أول اثنين توغا ألفا فيروسز. هسه شو فلافي فيروس، وإحنا شرحنا these viruses بالCNS1. St. Louis encephalitis virus is a major cause of encephalitis in USA. It means it is common. Vector mosquito, Culex mosquito, Culex tarsalis, similar to Western equine. The spectrum, it is similar to Western equine, لأنه the same on the same route, but higher mortality and higher morbidity. Morbidity معناتها اعتلالات مصاحبة. It is more common in subjects above 40 years of age. يعني أنا لو جبت لك أمراض بها children عادة وحكيت لك except St. Louis لأنه أكثر من 40 سنة. أوكي؟ فإذا إحنا نقرأ المعلومات هون بهالطريقة هاي. هذه هي الموسكيتو الكيوليكس. Western Nile virus. Again, it is transmitted by Western Nile virus and can cause Western Nile virus disease. Flavivirus, again, Flavivirus. طبعا الجايات كلهم راح يكونوا Flavivirus ما عدا واحدة اللي هي الكاليفورنيا which is Bunyavirus. فإذا للسهولة من الآن راح تكون الكل Flaviviruses عدا الكاليفورنيا. فإذا الفلافيفيروس incubation period 3 to 14 days, about 2 weeks, few days to 2 weeks. It is important worldwide. It is related to St. Louis encephalitis and Japanese bee encephalitis. Mosquito vector can infect bears, cows, human. It can be transmitted via organ transplantation, blood transfusion, breastfeeding. When mosquito bite can deliver the virus to the Langerhans cells, and then viremia will result. Once you have got viremia, CNS and other organs will be affected. The mosquito, again, is the Culex. Okay? Western Nile is the Culex. So it is related to St. Louis, لأنه St. Louis حكينا أيضا Culex. والجابانيز بي انكفالايتس أيضا Culex. فإذا أنت لو عملت جدول وأشرت هيك فد أرو لهون ولهون, it will be very easy for you. There are 3 forms of this disease, the Western Nile virus disease. 80% of the condition are asymptomatic. كل شيء ما يظهر على المريض. 20% will have mild fever for 3 to 6 days. Rarely you will get severe disease which affect the CNS. It can cause, for example, severe encephalitis. It can cause aseptic meningitis, meningoencephalitis, and encephalitis. And look here, very important points. You have to pay a lot of attention to it. It can cause Western Nile poliomyelitis, شلل الأطفال. أنتوا تعرفون في poliomyelitis which is caused by poliomyelitis virus. If I ask you, what is another cause for poliomyelitis? You will say the Western Nile virus. The poliomyelitis commonly it is caused by poliomyelitis virus. Sometimes there is another version of poliomyelitis which is caused by Western Nile virus. The patient will suffer from headache, fever, stiff neck, coma, a tremor يعني رشفة, convulsions, تشنجات وصرع, and may end up unfortunately with death. The disease may continue for several weeks, usually occurs in more than 50 years of age and in immunocompromised patient. I see immunocompromised patient, يعني ذوي المناعة المنخفضة. Diagnosis, CSF examination, you get the viral picture or called the profile. Okay, اللي حكينا عليها مع CNS1. ايش يحصل بالCSF1 من تغييرات مع الفيرال infection. Serology also you detect for antibodies to Western Nile virus, and also the most sensitive and the specific way for diagnosis is the PCR. Treatment supportive. Vaccine is underway. So you have to write a note that vaccine is underway تحت التجربة. Okay? Because we are going to talk about other diseases for which vaccine is available. And you should know what are the diseases for which the vaccine is available. ولا أنت كيف تنصح المريض أو الشخص تقول له روح أخذ الفاكسين؟ إذا أنت ما تعرف في فاكسين له كيف تنصح؟ So vaccine here is underway. كاليفورنيا فيروس اللي حكينا هسه هذا بانيا. اوكي بانيا فيروس. كنا بنحكي على فلافي فيروس except California virus. So it is Banya virus common in USA from the word California and also worldwide. Mosquitoes Aedes. Remember Aedes. راح نجي على مرض آخر اسمه زيكا فيروس. اوكي أيضا Aedes. ريزرفوار chipmunk. شو هو chipmunk؟ السنجاب معروف. So this is the Aedes insects. Important cause of sudden encephalitis, abrupt encephalitis. Frequently it comes with seizure, صرع. Okay. Now it is common between 5 and 18 years of age. Very important this point. لأنه احنا نتكلم على الأمراض Western Equine, infants, Eastern Equine, all ages, St. Louis, above 40. Now California virus 5 إلى 18 سنة. فإذا لو جاك سيناريو بهالإشي هذا مع سيزر, sudden encephalitis, right? You should be able to transmit it by Aedes. Japanese bee encephalitis. نرجع على نفس المنوال. This virus is Flavivirus, common in Asia, Japanese, Japan, India, etc. Transmission similar to St. Louis encephalitis وsimilar to Western Equine. معناتها شو هذا؟ Culex mosquito, right? This is how the way you read it easily. The host pigs, الخنازير, birds, accidentally go to human, mainly children. Remember, Japanese bee encephalitis common in children. Less than 1% develop clinical disease, and when the child develops such a disease, it is often fatal. The incubation period is between 5 and 15 days, about 2 weeks. Symptoms: fever, headache, vomiting. Then the patient will suffer from mental changes, neurological problems, weakness, movement disorders, seizure. Treatment: no specific treatment for viruses, as you know. Prevention: control mosquito. Is there vaccine? Yes, there is vaccine. Inactivated, killed vaccine. Can be used for individuals above 17 years of age in 2 doses, 4 weeks apart. And you may give a booster dose after 1 year. Now, vaccination for children is under a trial. هذا الvaccine for adults. For children, which is the most important one, is under a trial. Powassan. Again, look, Powassan here is the only disease among what we have mentioned, which is tick-borne. Tick-borne يعني تنتقل عن طريق القراض. وراح ناخذ محاضرة about ticks إن شاء الله. Again, this virus is a Flavivirus, common in North America, can cause encephalitis, which could be very severe and fatal. This disease, quite fortunately, is very rare. Only few patients were reported in the literatures, and its significance in a human being as a whole until now under investigation and is uncertain. The last one, Zika virus. تشوفوا WHO مهتمة بهذا الفيروس وبهذا المرض، وفي فرق جوالة في أفريقيا حول هذا المرض، وفي لقاح له. This virus belongs to Flaviviruses, transmitted by Aedes. وحكينا على الإيديز، حكينا الإيديز ينقل الكاليفورنيا فيروس أيضا. So Zika and California viruses by Aedes. The host monkeys. So monkey, human, mosquito. زي ما حكينا بالبداية. Sexual transmission have been reported very rarely. I have seen 3 cases reported in 2016. ليه اسمها زيكا؟ في غابة في أوغندا اسمها زيكا فورست، غابات زيكا in Uganda. It has been reported such an infection from 1947. So this virus related to the Western Nile virus, okay? Western Nile virus, and also related to the Japanese B. encephalitis. هذا الزيكا فيروس شو يساوي لنا؟ 3 أشياء مهمة. زيكا فيفر، حمى فقط. No other symptoms or mild symptom. Mainly mild symptom like rash, conjunctivitis, joint pain. The clinical association, ليش WHO مهتم؟ If it infects a pregnant woman, it can cause microcephaly. Microcephaly يعني رأس الطفل يكون صغير. حتى بالالتراساوند ممكن نشوفها. It can cause microcephaly. Remember, Zika virus can cause what? Microcephaly. رأس صغير. لأن ينقل الفيروس from mother to the child. In adult, this condition can cause Guillain-Barré syndrome, as other microbes. For example, Campylobacter can also result in Guillain-Barré syndrome, which is demyelination of nerves due to autoantibodies. You know that. Now, vaccine is available, as I said, which is inactivated vaccine, can be given to pregnant women and to children also. It has been developed since 2016. Recombinant vaccine is under research work. هذا inactivated killed. تكنولوجيا تتطور بالviral vaccine, so recombinant vaccine is under research work. This is the electron-micrograph of Zika virus. These are the virus particles of 40 nanometers in diameter, with outer envelope, these are the blue ones, and dense center. You can see it dense. Outer envelope and dense center or core. Diagnosis of arboviruses in general. Culture system, you can use animals. Newborn mice, you inject the newborn mice. The best sample that you can take from patient is blood, is the best source in early disease. CSF may be used also, and you can use for it real-time PCR. RT معناتها real-time PCR. real-time PCR هذا quantitative، يعني عد لك كم فيروس موجود عندك per mil، okay, or per cubic millimeter، okay. real time يفرق عن الconventional PCR. conventional PCR هو positive negative فقط. real time كم فيروس، عدد quantitative. multiple serological tests, which depend serological tests between antibody antigen reaction. Methods for detection of antibodies: hemagglutination inhibition antibodies, neutralization antibodies, enzyme immunoassay, specific IgM in early disease. انتم تعرفون ال IgM هو الأكيوت الحديث الجديد، المرض الجديد. يعني إذا أنت عندك مثلا 2 antibodies أو 3، خلينا نحكي IgM IgG. IgG recovered after a while, it will be IgG, but in the acute recent one, IgM antibody will be raised against that virus. يعني اليوم مثلا في زمن الكوفيد 19 الآن يقاس الاي جي جي على اعتبار أنه شخص أصيب أو أخذ لقاح فيقاس الاي جي جي. لو شخص خلال الإصابة تقيس الاي جي ام، وهي معروفة. يعني الاي جي ام هو الريسنت الكرنت الحالي، والاي جي جي هو الباست which has occurred a while ago. Treatment: no specific treatment for viral infection, as you know. However, they have found that Ribavirin may be useful. Ribavirin اللي هو الانتيفيرال agent which is used for hepatitis C, if you remember. We have talked about hepatitis C with the GI module, and we said Ribavirin. A prevention of arboviruses: avoid insects. سكرين، تستعمل هاي الشبكات العوازل على الشبابيك إلى آخره. repellents، هذه الطاردة، السبريز، في سبريز تطرد وتقتل الانسكتس. elimination of arthropod breeding sites، هذه تتكاثر في البولز البحيرات، so you can use insecticides، قاتلات للحشرات. السلفاتيك تايب البرية difficult to control، ما تحت سيطرة البشر. vaccination: you can immunize horses against Western equine and Eastern equine viruses. Also, you can immunize person working with viruses, person at work, which involve certain occupations to make them in contact with these viruses. Vaccine to human tick-borne encephalitis, we will talk about it next lecture, is one of the great achievements. Tick-borne encephalitis هذا كان في استراليا مرض منتشر كثير خاصة بين الأطفال ويعمل شلل. الآن في لقاح له. Inactivated vaccine we mentioned for Japanese bee encephalitis. Inactivated vaccine against Zika virus also is available, although they are working currently for recombinant vaccine, which will be better than the inactivated one. By end of this, we end this lecture, and if you have any question.
دكتور
نعم
عندي سؤال من فضلك.
تفضل.
الانأكتيفيتد فاكسين تبع الزيكا بس
نعم.
يعطى للنساء والأطفال؟
بيصلح.
لأنه كان مكتوب إنه بس أيوه هون to pregnant women and children. يعني
women and children.
يعني الناس الطبيعيين ما بنعطوا inactivated؟
لا، في المناطق، هو شوف، هذه اللقاحات سبيشال. يعني مثلا في الأردن هون احنا ما نعطي زيكا فيروس فاكسين، لأنه this disease is unfounded in this area. في دول أخرى، بينما في دول أخرى قد تكون common، يوغندا مثلا. ففي certain countries, especially in Africa, certain individuals are prone to get this disease, so it's better to vaccinate them to protect them.
تمام دكتور. طب دكتور ممكن سؤال ثاني؟
نعم.
ممكن سؤال ثاني؟
ايه تفضل، بالعكس
الله
انا ارحب بأسئلتكم.
الله يكرمك يا دكتور. الارثروبود سستيند معناتها الفيرتيكال ترانسميشن؟
معناتها vertical transmission. In other words, vertical transmission. تك 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 تك، كيف تنقل؟ أكيد vertical transmission.
طيب دكتور ممكن آخر سؤال بس.
Which is called sometimes trans-ovarian.
شو يعني
trans-ovarian؟
cross the ovaries. من يعني ovaries تبعت الحشرة صحيح؟
تبعت الحشرة.
طب دكتور ممكن آخر سؤال اللي هو بسلايد؟
آخر سؤال، وبعد إذا عندك أسئلة.
تمام. بس ممكن نرجع على سلايد 9 تبع دورة حياة الفيروس أو
أنا السلايد رقم 9.
لايف سايكل. أيوه
هذا 9. أوكي.
شو المقصود بالأسهم المنقطة؟
هذه المؤثرات على الإجز مثلا. هون الوذر، حرارة، برودة، شتاء، صيف، إلى آخره. فود، سبيس، بريدنج سايت، بحيرة ونشفت،
يعني تساعد في
البحيرة امتلأت بالماء، وهكذا. يعني مؤثرات بيئية هذه. تعرف الحشرات مثل الموسكيتوز موسمية. مثلا أنت الموسكيتوز مثلا هون بتكثر بالصيف، صح؟
صحيح.
وهكذا يعني.
فهاي المؤثرات تزيد من الترانسميشن.
أيضا تزيد. أيوة.
تمام دكتور. شكرا جزيلا.
عفوا بالعكس. أنتوا من أي طالب يسأل يفيد زملاء الآخرين اللي حاضرين معاه بالمحاضرة. في أسئلة أخرى؟
بالنسبة لي لا. تمام.
نعم.
بقول بالنسبة لي لا، أنا انتهت أسئلتي.
في أسئلة أخرى؟ أوكي. يعني في أسئلة أخرى؟ other questions؟ زي ما حكيت لكم، إذا طالب يحب يسهلها عليه يعمل له فد هيك شيت وحدة ويكتب بيها هاي التفاصيل اللي حكينا عليها ويقارن بيناتها، وأبدا مستقبلا تجي تراجعها للمحاضرة كلها ربع ساعة ما تأخذ من عندك. ترى محاضرة سهلة لو واحد يفهمها بطريقة لوجيكال، ومهمة أيضا في نفس الوقت. مهمة يعني في كثير من دول العالم بالUSMLE بالبلاب تيست you may encounter such questions. If no further questions, I will end this lecture and hope to see you next lecture inshallah. السلام عليكم.
وعليكم السلام وبركاته.
يعطيك العافية دكتور.
الله يعافيكم.